First in order, on the psychiatrist couch, we'll be asking them very in-depth questions. First, I have Vic Gatto. Vic founded JumpStart Foundry in 2015. It's a seed stage VC fund that's the most active healthcare investor in the US, making 43 investments in the last 3 years. They flipped the script on traditional investing, providing $150,000 in capital, sales, and operational support for companies, as well as innovating with existing stakeholders to address real industry pain points. I then have Trung Do next to him. He's a vice president of business development at Partners Healthcare in Boston, Massachusetts, leading the growth of their commercial and international portfolios. He was the president of Gene Insight before it was acquired by SunQuest Information Systems in 2016, and prior to Partners, served as director of operations at Pharmetrics, a venture-backed startup providing healthcare market insights. Lastly, but not leastly, we have Senator William Frist, who is a nationally acclaimed heart and lung transplant surgeon. He's a former US Senate Majority Leader, and he's partner and chairman at Cressey Company's Distinguished Executives Council, and recently formed Frist Cressey Ventures, and the co-founder and chairman of Aspire Health, the largest non-hospice, community-based palliative care organization in the country. So please give me a warm welcome for our panelists. I'm gonna sit here, yeah, perfect. There we go. So, having myself been trained in Boston before we came back to the Southeast, and I know when you hear of healthcare investment in the country, people think of New York, they think of Boston, they think of San Francisco. The Southeast often does not come to mind. And is that really fair? When you think of the numbers we've heard today, we heard from Bobby speaking earlier, that Nashville companies control 40% of all private hospitals in the United States. Forbes recently named Atlanta as one of the top 5 cities pegged to be a tech mecca. So it strikes me that maybe the question is not one of inactivity, but one of perception. But there is, of course, room to grow. And that's where we're going to talk about today. Because the room to grow is not in trying to imitate or replicate Boston or New York or San Francisco and out-competing them on that, but in finding the unique assets and resources that we have in the Southeast and leveraging those. So with that, we have our lightning round. I want each of you to please tell us, what is one of the unique assets that we have in the Southeast to becoming a healthcare innovation hub?
So I'll go first. I think probably there's a lot of things that you could name, but I'd say middle America, but certainly Southeast is a big piece of that. It's where the large bulk of population is in the country. And it's also where the chronic disease is and where the innovation is from a science and care delivery. So you think about Atlanta, Houston, New Orleans, Nashville, but then up into Cincinnati, Cleveland, Minnesota. That's where the real research is going on. They do a little bit of work at Partners. But a lot of the bulk of the research is in that middle America country. And that's where the entrepreneurs are living every day. Their kids play soccer with the other researchers, and they really know the best innovations and can bring it out to market.
Okay, thanks. John?
Yeah, if I can build on that, obviously I'm not an expert in the Southeast. This is my first trip to Nashville. What a wonderful city. I'll be honest with you. If more people knew about Nashville and knew how cool it was, I think you would probably see more attraction of smart, bright entrepreneurs here. Not that you're not doing it already, but I think part of the question that you'll be asking is sort of how can you improve. I would just simply say from what I've seen and certainly what I've read, just to build on what Vic just said, Nashville, and particularly the Southeast, has this great, unique asset, which is the population. And the majority of sort of what I'll call sort of the expansive network of practitioners and providers are here. And what you have here is naturally an ability to innovate at scale. And HCA is a fantastic story about that, right? In the 1960s and what you said earlier in your Q&A, Dr. Frist, which is really at the end of the day, places like Boston and the Bay Area, we do wonderful research and discovery, but you have these incremental breakthroughs that don't naturally get translated at scale. And at least what I've seen down here is a commercial innovation that thinks about scale, mostly because of its population and also because of its assets, which is a large and expansive network of providers. So.
And I first of all, welcome to Nashville, obviously, but I would add culture. And I spent 10 years on the East Coast, a number of years on the West Coast doing surgery and business, and come back to Nashville to do business and innovation and venture capital and private equity. And when I think about why I came back, it really is, as you look over the next 10 years or 15 years in this country, the job creation is going to be in mid-market, not huge, not coastal cities. If you just look at Gallup, other people say it again and again. So if you have where job creation is with good academic anchors, coupled with a culture that very much centers on knowing who you are, what kind of person are you, your trust relationship, about your family. It's a unique combination of future growth, where the people are coming to, coupled with creative environments like the music that you hear in Nashville has a narrative itself. And that culture itself is a great crucible, I think, for cultivating innovation and then going very quickly to scale, which you can do when so many of the companies in the South are in all 50 states in healthcare.
I think that's a fantastic point. So it's the culture, it's the end customers of the vast patient population that we have, and then it's the ability to go to scale with the large hospital healthcare systems that we have. So to flip that question, what's missing? Why doesn't the Southeast have that perception yet of the Bostons, the New Yorks, and San Fran? What do we need to get there?
So I have a strong opinion about that. So I think that, we invest across the country. So we spend a lot of time in Boston and Silicon Valley. There's just a different attitude towards a corporate partner engaging in the innovation ecosystem. And I call it sort of the science fair dynamic, where a lot of corporations in Nashville or in Chattanooga or Atlanta, anywhere in middle America, they view innovation as a science fair. Like, let's go see the cute little things on Saturday afternoon, and then we'll go back to the real business. And on the coast, I think they view it differently. It's just a part of their job to sort of always have this porous attitude of entrepreneurs are coming in, we're going out to see them, mostly for selfish reasons, right? Like, Oracle and Google are not being friendly to entrepreneurs because they want to be friendly. Mm-hmm. They're being friendly because they know that they're going to come eat them if they don't sort of engage and understand. They may want to steal their idea, they may want to acquire them, they want to hire those people. And I think sometimes the corporations in the Southeast, they talk about innovation, but it's much more of the science fair kind of attitude to it.
John, coming from the Northeast where there is that different perception.
Yeah, I agree with Vic. In Boston, I could talk about Boston. Obviously, I can't talk about Nashville, Southeast as eloquently. But what I would say is, in Boston, what I see is certainly a uniqueness that is similar in the Bay Area, which you have this continuum of large universities, big academic teaching hospitals, mm-hmm. and then you have a vibrant sort of financing investor community, and together, it's just one big ecosystem that has formed over many years, by the way. It just didn't evolve. And I think as part of that, I would say just a little bit of sort of, marketing for partners, and partners is the corporate entity for the Mass General Hospital and the Brigham and Women's Hospital, two of the biggest teaching hospitals in the country. And I think part of that is the culture over hundreds of years of real discovery and intellectual curiosity that's built there. And I think, the way I look at it is obviously a place like Nashville, you have all those elements. I wouldn't say there's weaknesses. I think it's a question of connecting the dots and tying that continuum together from actual concept discovery to actual translation, meaning validation of the ideas, and then integrate it into the actual clinical system or healthcare delivery system. I would argue that you have all those pieces. The question is, how do you knit them together and bring that intellectual sort of curiosity along that whole stage. The other thing I'll just simply say is obviously, workforce development is always going to be a challenge. We see it in Boston, especially in the area of healthcare IT and getting into data science and analytics. It is a challenge, and it'll be a challenge for everyone, not just Nashville, but even in other metropolitan peers.
I think, again, building on that, if I look at the South, and you really project ahead 10 years to what's needed in healthcare innovation, it comes back to an educated workforce. We have companies coming to the South. We've seen all the great car manufacturers where we are the center, where 20 years ago it was obviously Detroit and other cities. The workers, the industry is coming here, and it's reasonably technologically driven. And they're coming here because of cost of living, the quality of life, the four seasons, the reasons we were talking earlier that 2/3 of America is within 600 miles of where we're sitting right now. But the education of the workforce, and that's why I threw in earlier the importance of having really good academic centers, which we've got in the South. We've got Georgia Tech, and translational stuff is unbelievable in terms of engineering. And we've got the University of Tennessee, and we've got Vanderbilt here in Tennessee, and Meharry not too far away. But our K through 12 education, which is the backbone of what happens 10 years from now, throughout the Southeast, is also not very good. It's terrible. It's worse probably in California, I'll have to say. But if you look at places throughout the South where you rank people K through 12 education, and you know that's the future workforce in a global community. We're talking about Southeast, so we're talking about a national community, but we're talking about a global community. The attention has to be focused there in math, science, STEM, but overall general education. The Southeast as a whole still ranks 40th to 50th in terms of K through 12 education. Just the other big thing that I think we need here, specifically in Nashville, is a larger core of health information technology people. Lots of great work, but it's not like a Boston or a West Coast where you can go in and there'll be 10 people talking health IT. So K through 12 education and health IT are the two areas that I think we can continue to focus on.
That's really the raw materials that lead to the successful exits down the road, 15, 20 years down the road. Now, one of the things you talked about in the spectrum is, as you mentioned, Trung, is that there's a very rich intellectual curiosity and collaboration between the academic medical centers and the private sector in Boston. And yet, as you all mentioned, we have Georgia Tech, Vanderbilt, Emory, UT, you know, all the schools in North Carolina. How do we get those to play together? How do you do it in Boston? Of course, there's, as you mentioned, this 100 years tradition. How do we get a greater collaboration there?
Well, I think in Boston, just to state the obvious, you know, there's a density there, right? I think geography does matter, even though the world is virtual. I think the idea that you can certainly run into people and gather people together in a room to have conversations and to test ideas is not lost on us. So I think, you know, especially in Boston, what you start to see, and like many other places around the country that depends on government funding and support to do research and certainly experiment, what you're starting to see is new innovation models. And those models are really focused on corporate and industry collaborations now. And the nice thing, I think it's not necessarily strategic, but I think because of the universities and the academic medical centers that we have, over the last decade and a half, a lot of the companies, both in terms of life sciences and big pharma, and more now you're starting to see the big technology companies and ones that are big focus on big data and AI, whether it's IBM Watson Health or GE, you know, planting itself as new headquarters. What you're starting to see is the ability for us to interact in different ways and thinking about those innovation models in different ways. So for me in the Southeast, I think, once again, you know, you have all those components. I think one, you know, being spread more than we are in Boston or quite frankly in the Bay Area as well is a challenge. Certainly attracting sort of big IT companies or software or healthcare sort of data companies is a challenge if I think part of it is trying to knit together what the value is for a lot of these companies. And I think the value, quite frankly, that I would suggest, you know, the Southeast would think about is a lot of companies are looking for data, and they're looking for access to clinical experts who understands how to apply those use cases against a set of data, real-world data that allows them to get some insights, whether it's into improved process of care or, quite frankly, to, you know, have a better view of clinical insights, you know.
So I have a counterpoint. I mean, my feeling is that the Southeast should not try to replicate Boston and Silicon Valley. I mean, I think those ecosystems were created pre-internet, right? So the reason there's a density is you had to go talk to people. You had to walk down to MIT and then sort of drive a mile to 5 miles away to Cambridge or maybe the 128 belt.
That's right.
And that's all there was. And I think similar to sort of the third world not doing landlines because we have cell phones. Like, why do you need landlines in India? You don't. Let's leapfrog that and do cellular technology. The Southeast has a chance to say, we understand the heritage of Boston. I grew up in Boston. It's a great city. But we can do it better. It's going to be different because we have the internet now, and we can connect like-minded individuals from across the Southeast United States, or I'd say all Middle America, and do great things. And so we started a conference called Health Further. There's this conference, 3686, really coming together around a common interest. And let's share things in person, because you need to build relationships, but then exist in a community virtually, and sort of leapfrog Boston and Silicon Valley, and they'll always be great. You know, I love to go to Boston. I wish they had a better hockey team. The Nashville Predators are crushing. But I think, you know, we can learn from them and then do our own thing is what we should do.
I fully agree. Absolutely. So then how can entrepreneurs and all the entrepreneurs in the audience, how do they create those relationships? Yes, at conferences like this, how do they create those relationships with HCA, which is, I know, is one of the things you said, HCA and the other hospital systems that we have is a big asset of the Southeast to be able to take those ideas to scale. How do they get there?
Yeah, so I started JumpStart Foundry to solve that problem. So my view is that the Southeast entrepreneurs and Middle America entrepreneurs are really more talented than the Boston and Silicon Valley entrepreneurs. It's kind of like Rocky, right? Like, I want a battle-hardened, scrappy entrepreneur that doesn't just get millions of dollars handed to them. That's what I want to invest in. But like Rocky, right, you need a shot. You need a shot at the title. If you're always just kind of hanging around chasing chickens, you don't get to be famous. And so you know, JumpStart exists to, I call it English to English translation. Like, how do I talk to corporate America and sort of convince them that they need to pay attention to innovation for selfish reasons? I mean, forget the nice community service thing, create jobs, all that stuff. HCA and United and Cardinal and Amerigroup, they're shareholder driven, right? They need to hit earnings. And so this touchy-feely community thing is nice, but I'm going to be on an earnings call and I need to deliver earnings. And so we do that translation and try to give, you know, our battle-hardened entrepreneurs a shot at the title.
And I'll just add that, and it comes back to my initial answer to your question. The appealing thing about Birmingham, Atlanta, or it could be Knoxville, it could be Nashville, is to establish a community of sincere and genuine communication. One of the advantages that we have here in Nashville is we have a Nashville Healthcare Council. And the Nashville Healthcare Council has been around for 20 years. Every 3 weeks, it brings 200, there'll be one today with 300 people in a room. We'll listen to a speaker and interact with them with receptions before and receptions after. And in the audience will be the CEOs of the 18 publicly held companies in health services here in Nashville. But that will be intermingled at the same table with the innovators, the people who are not part of those companies, but the people who have ideas. And that sort of acceptance and cross-communication, I think, is where the great ideas will come from. And it means you need a flow of capital, and the flow of capital in the South is getting better. I probably should have put that in a little bit of the things we need to work on, because the flow of capital is not as big as the coast. It's increasingly changing. My firm, Cressey Company, and I mentioned we have about $1 billion committed capital. We saw that, and we were in Chicago, so we moved and put a physical presence here. And once we got here, deals started flowing, the communication there, because you're running into everybody. You have the Nashville Healthcare Council. You can find good CEOs. You can find good CFOs. They're all here, and they've been in healthcare for the last 10, 20, 30 or 40 years. And then we said, well, we even need to go earlier than mid-market private equity because of the venture world, and we started Frist Cressey Ventures for the same reason. That's continual flow of capital that companies need, the ideas the entrepreneurs need to go to a Series A, and the Series A to a D, and then D on to mid-market private equity. It is maturing very fast in the South. But what is necessary is that dialogue of the CEOs, of the strategics, of the big multinational companies here sitting side by side with the innovators. And in the South, that goes on much more, at least in my experience, than it does in other cities.
Yeah, so I agree with that. In healthcare specifically, we don't have a common language, right? So entrepreneurs will talk about disruption and big change, and that is pretty scary to a surgeon. Or like I don't know if I want to disrupt your heart surgery suite. Like, you know, there's life and death there. And so JumpStart, we teach entrepreneurs about, let's talk about transformation. Let's talk about delivering better care, better outcomes, and that will involve change, but let's do it. I mean, healthcare is unique in that we have to change all four wheels while we're driving 70 miles down the road, because my mom fell and broke her hip in Minneapolis, and she had great surgeons up there that patched her up. I don't know if I want to disrupt that process, right? But we do need to fix it and make it transformed and more efficient.
It strikes me that we've been talking with a lot of the raw materials here, but the next steps are connecting all of these raw materials and then injecting the capital so that it is present to be the fuel to the fire underneath them. We can't neglect the role of policy as well. And so, Senator Frist, wanted to ask you about the role with the particularly changes around Medicaid and other policy changes. What impacts can that have for entrepreneurs now and in the next 5 to 7 years?
Yes, and my 12 years in policy world in Washington, D.C. taught me a lot. I loved it. I loved serving the country. I loved representing, as majority leader, the whole nation, but also individuals, and felt that I had a big responsibility because I was the first practicing physician elected to the United States Senate, the highest legislative body in the free world. I was the first doctor elected there in 65 years. So the voice, the narrative of a doctor or a nurse and a patient and treating disease and prevention hadn't been on the floor of the United States Senate in a real way for 60 years. Now there are more people there, and it needs to open up. We need to interact with our legislators. We need to write letters, go see them, go see the staff, give them the reality checks that are there. Washington is chaotic now. It doesn't have effective leadership now, but that's our responsibility. We need to get there and contribute there. From an impact standpoint, because a lot of innovators, and I find it more so on the West Coast than the East Coast, they say it doesn't matter what happens in Washington, that we can innovate around it. And it's a pretty naive thinking that has gotten a lot of people in trouble over time, because there is a rule of law. There is a rule of ethics, and several companies on the West Coast, I've been involved in some of them, just got way off track because of operating outside of a rule of a moral code or a social contract itself. I say that because that is a responsibility of government, to look after the most vulnerable people in the world today. That a true market-based, competitive, capitalistic system does pretty well with it because it lifts everybody up, but doesn't do perfectly, and that's where the social structure and social policy is important. We'll see it play out real quickly here at Medicaid, very likely in the next 2 years. The open-ended entitlement of Medicaid, which is responsible for 77 million people today. Before Obamacare, it was 66, 11 million additional people. What do you do with those 11 million people if you repeal? Well, for one thing, they'll still go to emergency rooms. They won't get as good a care, but the cross-subsidization, the inefficiencies are going to come back. Who's going to solve that? It's going to be innovators who come back and say, we all of a sudden went from 30 million uninsured today to 52 million people who is an American people with conscience we are going to take care of. How can we do that without driving administrative costs to 30%, inefficiency, driving up the cost of health care for everybody else? Well, that needs to be solved. It will be solved by innovation. It will be solved by big data. It will be solved by machine learning. It will be solved by better analytics and by better software and by companies that come out of Memphis, Tennessee, and Knoxville, and Birmingham, and Nashville, and places like that. That's who it'll be solved. They are positioned because of the reach, as you said, 40% of all for-profit hospitals, millions and millions and millions of patients. Right now, about 60% of all transactions flow through companies that are based in Nashville. With that sort of reach, you pick up what the needs are, and perceptive innovators say, if that's the need, I've got a solution. And then we can come back to the things we were talking about, how you actually translate that coming forward. So with Medicaid, the certainty is going to be, or policy in Washington today is less federal control, more state innovation, more Medicaid waivers for those 77 million people, and greater involvement of attention to the social determinants being the real drivers of health. That is transportation and food and behavior and seat belts and smoking, being the real drivers of health, and not just more hospital beds or more heart surgeons like Bill Frist or more doctors or more nurses. That rich integration is a gold mine for innovators who are thinking about the social good of health as well as the profit motive and being able to use the profit motive to go to scale and reach more people around the country.
The exciting experiment, and it's exciting like getting on a roller coaster that you don't know if it's finished yet. So that's what I think is that Medicaid is going to push responsibility for payment to the states. And I think we'll have 50 states choosing, there'll be 30 experiments. And if you're in a strong state like Tennessee, we already have, I work with TennCare closely. TennCare is already getting ready for that. They're already well positioned for that. They're doing lots of experimentation about, as we have full responsibility for this population, $11.5 billion spend a year in Tennessee just on Medicaid. How do we do that more effectively and deliver better care? But other states are not as strong, and you should leave their income here because they don't have the strength, they don't have the policy, they don't have the budget, they don't have the financial strength to do it or the healthcare knowledge. And so they're going to have lots of experimentation, and that will be messy, but there'll be winners from that. And then innovators will take that learning and bring it out to the commercial market. And then I think eventually that will become standard of care. But that's going to be a 10 to 15 year experiment. And if you're in the state of Illinois, where Bill's company is, they don't have the same infrastructure. So they'll have to work much harder to catch up. Tennessee is well positioned to be a leader in that. But it'll be fun to watch.
And just because all this, when you're on a panel, you're talking top lines. But just an example that, because when I was reading sort of my news this morning, 59,000 people died of opioid addiction last year. It's the fastest growth, 2016, the fastest growth that the country's ever seen. If you look at Medicaid, where your question was, if you look at most Medicaid sectors now, and you really started to break them down, the fastest growing is the product of opioid addiction. It's hollowing out families, it's hollowing out communities all over the country, especially along the Appalachian spine, sort of about 15 states. And then if you dissect that out, what is driving it? One is the opioid addiction and neonatal abstinence syndrome, or addicted moms having kids. State government does a pretty good job. Nonprofits do a pretty good job, but obviously it's not working with the demand. So a group of people in Middle Tennessee got together and sat around a table and said, we got to address this. It's our responsibility today, and started a company called 180 Health Partners. And what it does, it wraps a team using analytics to identify who needs it or not around a 35-year-old mother who is addicted, maybe a lawyer who has back pain and was given opioids, and having a baby that has that baby, has to be detoxed, will be in the hospital for 32 days, at least $67,000. There is a solution to that. We have the science, we have the people. So you create a company, you create the company to address neonatal abstinence syndrome on the baby and the mom, and all of a sudden, instead of being $67,000 cost of that delivery and the month after, it goes down to $8,000. Huge savings, but most importantly, you improve the benefit, the whole life of that baby and the mom themselves. It's just an example of how Medicaid, exploding in cost, a product of society today, government is not the answer. It's innovation, but it takes the idea of the innovator, access to capital itself, then policy, because you have to go to the payers and say, you have to adjust your payment mechanism. But it's just an example of the huge opportunities that are going to be underway as policy moves.
It's the American way, right? The for-profit motive and the entrepreneurial spirit and the can-do attitude will fix these problems. But it's messy, right? There's lots of experimentation, and it doesn't always work.
Yeah, and absolutely. And it's one of the things that is unique about the Southeast. It's the idea, but it came from a problem. And it's finding that close integration with the hospital systems that we have, that you truly have the customer there and integrating with them to identify the problem, because innovating in healthcare isn't just it's not like in other industries where you need a car, you have Uber, you need a hotel, just get Airbnb. Innovating in healthcare is much more complicated, but I know that Trung, as you and I have been talking about, having those end customers to be able to work closely with and de-risk it, because you are executing in real time and doing that proof of concept of your product to really be able to succeed in the South. So,
I was going to say, in the dialogue, again, this uniqueness about the Southeast, I don't want to overstate it because it's really unfair. I'm sure you're sitting here saying, well, we do that in Boston too.
Not as well, though.
But literally, you'll go, and this is in Memphis too, in the biosciences and the device world, which is a lot more sophisticated than Nashville is. So it's all varied. I'm using Nashville here. Yeah. But the conversation for end of life, again, I was in Washington, D.C., the end of life was committees to death committees and panel when I left there. But at the same time, this huge societal need that we all feel the last 6 months of life are chaotic, expensive, terrible intensive care units. The only answer there is private sector. So the private sector, you come back, and we started a company called Aspire Health, and it's exploded, it's doing well, it's serving 40,000 people. We just started 3 years ago. But it's a need that you see. It took an innovator like Brad Smith, who's the CEO of that, but then it took the connection of being able to talk around the table, come back to the culture, of the CEOs of the payer community that says a straight fee for service, you'll never have good palliative health care, maybe Medicare Advantage. So that conversation between innovation and the CEOs has to go on, and the CEOs have to say, okay, we can do a at-risk model, even in a fee-for-service world. And so that dialogue, continuity. I will say, for those of you who aren't from cities, things like the Nashville Healthcare Council, I've been to Chicago, been to Austin to do a similar sort of thing where there's a crucible, a dialogue, an ongoing conversation, formalized every 3 weeks, everybody getting together is a great thing to take back to your community.
So we're going to run out of time, but I think I study a lot what I'm going to call value networks. And if you're going to successfully launch a new product, you have to understand the full value network. Uber replaced the whole thing, lock, stock, and barrel. And in healthcare, it's much more complicated. There aren't discrete value networks that you can easily just sort of lift out and not have anymore. And so in order to be successful, you have to be able to plug in and work with the existing parts of the value network. And you can only do that where there's enough communication to go. It can happen in Boston, it can happen in Nashville, but you have to understand it all.
No, I agree. With the minute left, the only thing I would say is obviously this great conversation, and you guys know the community and the environment much better than I can. The only thing I would say is just to sort of make it agnostic. And the inventor dilemma and an entrepreneur dilemma, and many of you guys are entrepreneurs there. The challenge is always getting the business up to $1 million, right? A couple $100,000 but the question is the breakthrough. And for me, at least, what we've seen, at least in Boston, when we talk to a lot of entrepreneurs and companies, they get to that point, and one piece that's missing is this conversation that we're having right now, which is that value network, which is how do you connect the dots and actually take things all the way through sort of that value creation, right? From concept all the way through scale. And there's a big piece in the middle here is when we actually have folks come to us and talk about their solutions, a couple questions that I always throw out there just to get a sense for whether they've connected the dots and had the conversations appropriately with the customers or the constituents who are a part of the sort of the supply chain. Yeah. And the question is always one, sort of, how was the concept conceived? Do you have the right folks in the room to have that conversation? Two, sort of, how do you validate it? And the validation is generally one part data and real-world evidence, and the other part is just clinical workflows, getting it into a system where you actually have providers and clinicians and administrators and patients actually touching it and using it to see actual feasibility, one, and then real outcomes. And the third thing is always the toughest one, the last mile, which is clinical integration. There's generally, especially around the solutions that we're talking about, which is either clinical systems or people processes, how it actually works and how someone consumes it. And generally, when we have conversations with a lot of entrepreneurs, that last piece has never been thought through. And I'll give you a perfect example. The biggest buzzword is artificial intelligence, machine learning. We get a lot of companies, especially in the diagnostics field, like imaging. They'll come to us and say they've got the best algorithm and models to basically identify certain things, right? Images, nodes. And then we'll ask a simple question, which is how would a radiologist use it with respect to interpretation and reporting? And if it's not in one of the big systems like Nuance, Modo, it's a killer. It's dead on arrival because no radiologist will use it. So that's just an example.
So I have the solution to that. Let's take the best 500 people you know in Boston and bring them here next year and connect the dots and sort of get the best technologists here to Nashville and the whole ecosystem.
I would love it. I think it's fantastic.
All right.
There we go. You're done, Charlie. We've scheduled it. Thank you again. I think the theme here was the integration that we can have. That we have the raw materials, but integrating them, injecting them with that capital and that fuel. And really, as you mentioned, Trung, that clinical integration at the end. And when you control 40% of the hospitals in the United States, we're in the right area to be doing it. So again, thank you so much to all of our panelists. Let's give them a round of applause. And thank you for Launch Tennessee.
Good. Thank you.
Great. Yeah,
I like
good to see you. Yeah.
Let's do it together.
Yeah.